very important when it comes to caring for the neonates. Okay, so we check on the airway. So when the baby comes out from the vagina, the baby's head is out. So we definitely wipe the mouth and the nose. All right? Then we stimulate the baby to cry. Okay? Pero hindi natin papaiyakin yan kung ulo pa lang po yung lumabas. Siyempre, buong katawan, when the baby is placed on the abdomen of the mother, so that will be the time that we would stimulate the baby to cry by drying the baby. We rub the back, front, chest part, and back part, so the baby would really cry. If there is a need for the baby, if the baby did not cry, no, even though you stimulated the baby already, the baby is ready dry, but the baby did not cry. So the baby needs further suctioning. So that is why a rubber suction is readily available for you to suck, of course, the nose and then the mouth. All right? Then, to further oxygenate the body of the baby, because delayed yung crying niya, we administer oxygen. Okay. If worst comes to worst, ihuhook po natin siya sa respiratory machine. And that would be ordered, no, by the pediatrician. If ever the baby has really a hard time, no, in birthing, so kailangan natin siyang i-hook sa machine. Then of course, equally important would be the temperature. For the baby not to experience hypothermia, no, we should dry the baby because the baby is used to a wet environment. So meron siyang amniotic fluid inside the uterus of the mother. It is warm, no? Kasi nag-regulate na ng temperature yung amniotic fluid natin. And naturally, the mother is warm. So as the baby inside the womb. Then when the baby is born, the baby is exposed to a very cool environment due to our air conditioning unit. That is why the baby would really have hypothermia. So in order for the baby not to experience this one, because the baby will be placed in a critical position, no? If the baby would experience a hypothermia. So we dry the baby. After drying the baby, we wrap the baby with a towel. Then, of course, coupled with that, after wrapping the baby, we put gooseneck lamp or light over the baby. Then, avoid unnecessary exposure. Dito lang po ng bata yung nakikita. Everything is wrapped. Okay? Avoid unnecessary exposure. Then, place inside incubator if the baby is premature. Right? Okay. Then, of course, we put the proper identification of the baby. And one of that one would be the name band. Okay? This includes the mother's name. Yung name band niyang nilalagay talaga natin on the right side of the baby sa foot part. Okay? This would include the mother's name, the sex of the baby, and the time of delivery. No? Etong footprints na ito, ginado away na ito, guys. No more footprints. No? It is no longer done. Before, ginagawa pa yan. Meron pa yung mga footprinting, yung mga baby noon. Pero ngayon, hindi na po. Kasi kino-consider na makakause ng infection din yung ink, no? That is being stamped on sa paa ng baby. Okay? So, i-do away na po yan. So, ano ang nakalagay na lang sa baby are the name bonds. Okay? Na merong pangalan ni mama, ang sex ng baby, and time of delivery. So, usually, ang name lang ni baby dyan is, kunyari, baby boy Kaburnay or baby boy. Hello? Are you still there?
Yes, ma'am.
Ma'am.
Wait lang, ha? If you don't want to use your microphone, can you please chat if I'm clear or not? Or shall I continue or not?
Clear ka po, ma'am.
Clear po, ma'am.
Clear po? All right. So after the proper identification, first guys, airway tayo. And then of course, we regulate the temperature. Then we put on the proper identification of the baby. Because sometimes, good guys, no, may kasabay po yung mama. Then lahat magkakasabayan doon sa nursery. So if you are in charge of the baby, one-on-one po yan. If you are in charge of the baby, so you will be the one to fill out the proper identification or the name band of the baby. Right? So we go now to the care of the cord. So milking the cord towards the mother. Before kasi, we milk the cord towards the baby. So ngayon naman po, minimilk po natin yan towards the mother. Kasi hindi naman daw necessary. Research has been done and it is not necessary for us to milk the cord towards the baby to add some RBCs. No? So, yun. Wait lang. Nagaano siya? Nagaputol-putol ako.
Si ma'am, putol po.
Yes po, ma'am.
Copy po, ma'am.
Yes, ma'am.
Hello, can somebody tell me kung karat siya?
Letter na po,
Clear
ma'am.
na po.
Okay, thank you. All right. So we are, can you see my slide?
Nag-loading po po, ma'am.
Hello.
Makita
Hello.
Makita na po ngayon.
Oh no. Hindi ko maintindihan.
Makita na po, ma'am.
Okay, can you hear me?
Yes po, ma'am.
Yes po, ma'am.
Bakit siya nagkaparat, guys? Hello? Okay. Mr. Roja,
Yes, ma'am.
can you hear me
Yes po,
clearly?
ma'am. Yes po, ma'am.
Okay, kasi at my end, karat kayo eh. So, ganito na lang ang gawain natin ha. I will continue on my lecture and please message me right away kung hindi na talaga kaya or ano na nangyari sa aking mic. Hindi ko na talaga ito maintindihan guys. Palipat-lipat na ako ng place. Alright. So, saan na tayo? Sa milking of the cord. Alright. When the baby is born, no, we are tasked to, what you call this one? Hold on to the cord until the pulsation stops. If the pulsation stops, so an inch from the abdomen of the baby, we put the plastic cord clamp. All right? Then we milk again from the plastic cord clamp towards the mother about 2 centimeters. Then we put on the Kelly or the curved clamp or straight clamp. All right? I know na magdi-DR man siguro kayo guys after community. So you can really appreciate that one. Pero if ever, I will just show you if we have really time na kung ano, yung mga instruments. But for now, ito lang muna tayo, okay? I just wanted to explain how it is done. All right? After placing about 2 centimeters from the plastic cord clamp, you're going to milk the cord towards the mother. So without removing your hand from the milking. So pagdating mo ng 2 centimeters, you get the instrument from your sterile table to clamp kung saan ka nag-stop ng 2 centimeters. And then when you lock the clamp, you hold the clamp. And then, kukuha mo ngayon yung scissor. Then you cut near the plastic clamp. So napagitnaan po siya. Napagitnaan po siya ng dalawang clamp, the plastic clamp and your instrument. So it is advised in the hospital that you cut the cord near the plastic clamp. Why do we milk it towards the mother? And why should we not remove our hand from milking? Once you milk the cord, you cannot release it. Why? Because the blood would be going back. So the purpose of which is to protect ourselves from any spurting ng blood when we cut the cord. All right? There is no other reason, no, for it. So before, we milk towards the baby because we wanted to the baby to have extra blood. All right? So extra RBC, no, that is good for the baby. But it so happened na once the pulsation stops, the blood is no longer good. Okay, so it should be with the placenta and the cord towards the mother. Okay, so the cord is dressed aseptically. So nowadays we do not dress the cord anymore. We let it be. Okay? So, nakakabit sa pusod ng baby yung plastic lamp. And we should not put anything, any chemical, alcohol, no. No? Once the baby is born. So, we let it be lang natin siya na ganyan. And it is already open. Hindi pwede natin balutin kasi meron tayong mga abdominal binder, no, na nabibili natin doon sa baby section sa mall, but we no longer use that one because it is advised that it should be open. No, when the baby goes home, no, it is binibigyan talaga yan ng advice or health teaching yung mother on how to take good care of the cord. So, air dry lang po yan siya and then alcoholan lang po. Yun. pag nasa bahay na. But in the hospital, we only put alcohol if we wanted to remove scabs, no? Yung mga dried blood ano around the cord kasi as the days goes on, the cord would dry up, no? Then further recuperation would happen when the baby is already at home. So the mother is taught on how to go about, on how to care the cord. All right. Then, of course, we have this care of the eyes. After the cord, we do the care of the eyes. So this is called the CRIDS prophylaxis. This prevents the baby from acquiring ophthalmia neonatorum. So the medication that is used is teramycin. All right? So, ito siya is a form of antibiotic. Because the baby, saan siya dumaan? Doon po siya dumaan sa vagina. So, meron po tayong mga normal flora. Ang mother may mga normal flora, particularly the E. coli. No? We just don't know the undiagnosed cases or undiagnosed disease of the mother on that particular day na nag-deliver siya. If the mother has urinary tract infection, the more po tayong maglagay ng CRIDS prophylaxis. But there are times, no, that the mother would not allow any medication being given to the baby. So we respect that one and we let the mother sign the waiver. All right? So, ito yung ginagawa natin for sa eyes. It's CRIDS prophylaxis. Don't worry about that because you will be taught on how to go about this one when we will have your DR. So, at least kung may theory kayo na ano yung tawag sa care of the eyes of the newborn, mami, ito yung CRIDS prophylaxis. Para saan yan? Para i-prevent po yung ophthalmia neonatorum or yung tinatawag natin na infection of the eye ni baby. So, anong gamot ang ginagamit? Teramycin po yung ginagamit natin sa ating hospital. Alright? Then the sixth one would be the vitamin K injection. So, this is given at the left thigh of the vastus lateralis or rectus femoris. Alright? So, it is SOP ng Department of Health na ang vitamin K po talaga, ini-inject po yan sa left thigh ng baby. Ang ini-inject po natin sa right thigh would be the hepatitis B. Okay? If you are assigned at SPMC, you will inject the two thigh of the baby. You're going to give vitamin K sa left and you're going to inject food, Hepa B sa right side. And all of it sa vastus lateralis or sa rectus femoris ng baby. Alright? So, yun. All right. So we also have what we call the newborn assessment. Okay? So this is called the UPGAR scoring. Etong UPGAR na ito, may ibig sabihin ito na mnemonics niya. Okay? So this is it. So appearance, pulse, grimace, or the response of the baby, activity or the flexion or movement of the baby, and of course yung paghinga ni baby, respirations. So that is your UPGAR. On how this is done on the and done on the after. Okay, this is done at 1 and 5 minutes of life. So first minute, mag-UPGAR scoring si nurse. Then after 5 minutes again, check on the UPGAR. Kasi at so 1 minute pa lang, paglabas ni baby yan, good cry, meron ka na pong score sa grimace part. Okay? So, ang 0 points would be when the baby comes out, it would appear blue or pale all over. No? So, 0 po yung point natin dyan. But if the baby would appear blue ang extremities, but ang torso naman niya pink. Both extremities niya, the upper and the lower extremities are blue, and then the torso is pink. So, score natin siya ng 1. Then, 2 naman, perfect score if pink siya all over. Okay, then we go now to the pulse. So, when the baby is out, you're about to check on the pulse of the baby. You cannot feel anything. That is 0. But if you can feel it and then you count it, it is less than 100. So, that would mean that the score is 1. But if it is more than 100, So more than or equal to 100. So the score would be 2. Okay? Ang grimace naman, yung how the baby responds. So 0 kung no response. Then weak grimace when stimulated. No, kung imo lang i-rub ang iyang chest, moana lang ang baby, so you can score it at 1. Pero pag ang baby nag-cries or pulls away when stimulated, hilak gid siya kapag ayaw, that is perfect score 2. Then sa activity naman, lupaypay si baby paglabas, wala gyud, nakahiga, nakalupaypay. Ana lang ang kamot, pag imuhang ko anon, itaas as ibaba. Walang reaction si baby, walang galaw. Then score mo dyan 0. Then of course, if the score is 1, there is some flexions of the arm. So hindi naman masyadong flex, pero parang nagalaw lang niya ng ganyan, no? So there is still some flexion. So score mo siya ng 1. But arms are flexed and legs are resist extension. Okay? Kaya always man talaga naka-fetal position si baby. So pag ganyan, piko din ang paa sa baba. Then pag stretch, stretch din tanan, no? Lalo na pag nagulat si baby. Nakakita na ba kayo ng baby na nagulat? Parang gumanyan. Then pag ganyan, iyak. Ganyan na kaagad yung baby. No? Then respirations naman, wala. 0. Then weak, irregular, or gasping. Nakikita mo na yung mga intercostal muscles niya. No? Mga bukog niya din, mga ribs niya din. So, that is an indication that the baby is having a problem. No? You score it 1. Then, of course, if the baby really cries very strong and very hard, so 2 po siya. So, meron tayong mga equivalent points diyan depending on the assessment of the nurse. So, nursery nurse, it has a very big role, no? When it comes to newborn assessment. So, dapat very quick siya. Memorize na yan ng mga nursery nurse. 0 to 3, ang overall total niyan, it is very critically low. So, that would entail a lot of management. So, 4 to 6, fairly low. Some management siguro. And 7 to 10, generally normal si baby. Tagang score niya 7 to 10. So, meron tayong further interpretation of this one that would really show na yun, score interpretation. So, 0 to 4, poor ang baby, in serious danger and needs resuscitation. So, ito yung nakikita natin ng mga baby, no? Nilalagay siya sa naka-intubate si baby, no? To help the baby have proper oxygenation. Kasi kailangan natin ng proper oxygenation or else some of our major organs would die. So we don't want that to happen to our baby. So yan. Kung 5 to 6 naman po, condition is guarded, may need airway clearing and oxygen. Baka naman lang, kaya hindi naka-oxygenate lahat, maraming secretion si baby. So kailangan natin ng deep suctioning with the use of a catheter. Ini-insert yan ng mga pediatrician. And we are there to assist. But if the pediatrician would say, sige ma'am,isuction natin. So, instruct lang siya ng instruct. So, we will be the one to suction the baby. Pero in cases of babies that is placed in a critical condition, no, students are not allowed to handle muna until such time that the baby will be stable enough for us to handle. So, they would say, sige na po ma'am, okay na po. Then we will do our newborn care. Alright? Kung ang score naman 7 to 10, the baby is good, newborn is doing well. Alright? So, yun. Yan yun siya si APGAR scoring. And ginagawa po siya every first minute and 5 minutes of life ni baby. And then, meron pa rin tayo, next to that APGAR is your anthropometric measurements. Alright? You have the birth weight, the length, head circumference, chest circumference, and of course, the abdominal circumference. And these are the equivalent values on the right side. All right? Kung birth weight naman, from 2.5 to 4 kilos. Before, 2.5 to 3.5. But we have nowadays, latest research, na meron na talaga tayo mga 4-pounder na baby. 4 kilos na baby. No? Mga 8 to 9 pounds na yung mga baby na yan, no? If you're going to multiply this 4 kilos into 2.2, what would be the equivalent in pounds, no? Yun na yun. So, meron talaga tayong mga 8-pounder na baby nowadays. So, kino-consider, ini-extend na ng Department of Health yan. Ang length naman is from 45 and 53. If you do not know how to measure the length, base gunyag mahimong punggok imong baby, matingala ang doktor, dagko itong baby, nga no, ingani man, murag putot. So you really need to follow the contour of the baby. What do I mean by this? From the heel of the foot, di ba, meron tayong tinatawag na gastrocnemius ni baby. So from that heel, you measure it, the gastrocnemius, you follow the contour. So kung ano yung contour ng muscle ni baby, yun ang ifa-follow mo until such time you reach the vertex area. Okay? Yung malambot na area dyan sa kanyang ulo. Okay? Then the head circumference, don't worry about taking the anthropometric measurements because you will be taught also when you will have your DR. So may mga RD na tayo niyan, face-to-face, no? You're going to memorize how it is to prepare a DR table, how it is to take good care of the newborn. So you will have a one-on-one RD with your clinical instructors kung sino man yung ma-assign sa inyo. Then the head circumference, dito po yan. Sa taas po ng eyebrows, nilalagay yung tip ng measurement at tip ng tape measure at the same time ang end. So the equivalent normal values for that one would be 33 to 35 centimeters. Then of course, ang chest circumference din. Mini-measure din natin. Sometimes kasi, mas malaki pa ang chest sa ulo ni baby. Which is, there could be a problem. Maybe the baby has a problem in respiratory problem, mga ganyan, no? So mini-measure siya sa nipple line talaga ni baby, no? So equivalent niya is 30 to 33. And of course, we also have the abdominal circumference. Meron tayong one time na mga abnormal na mga measurements ng baby. It is because there is a problem with the GI system. Okay? So, abdominal circumference measures 28 to 30 centimeters. All right? Ayan. So, let's go now to the vital signs of the baby. The heart rate should be 120 to 160 beats per minute. Diba? Ang bilis-bilis. Then the respiratory rate should be 40 to 60 beats per minute. Lower than that, dili ka palakawon sa nursery until such time you've reached these normal ranges. Then here you are, temperature. Initially, we get the temperature rectally. Isang beses lang po yan siya. First time na tawag dyan, first time na kukunan ng temperature si baby is to the rectum. This is because to check also for the patency of the rectum because some babies are born with no holes sa kanilang anus. No? So, yan. So, ang normal niyan is 36.5 to 37.5. So, kung sino sa inyo na nalagay na dyan sa isip nila na ang normal temperature is 36.5 to 37.5, ang adult, wrong po yan siya. Kasi pang newborn po ito na temperature. Alright? Then the rest of the temperature, if you're going to monitor the baby 15 minutes for an hour, you're going to take the temperature, the rest of the temperature through axillary na po ni baby. No, one time lang po tayo mag-check ng rectum if it's the first time of the baby na mag-check ng temperature. Alright? Two purpose yan, core temperature and of course, check for the patency of the anus. Alright? Yan. Alright. So, ito yung mga picture on how they're going to measure. The first picture here is of course the weighing scale. So, hindi po kasali ang mga lampin or mga clothing ni baby when you weigh the baby. The baby is hubot-hubad po si baby when we measure. Alright? Sa head circumference, and then the chest circumference, and of course the length. So, experts only do this type of measurement sa length po. Okay? As you can see, stretch gyud nila si baby. No? Tapos, edge to edge po yan. No? Ang paa ni baby, hindi po yung toes niya ang nakaganyan, kundi yung heel po niya pantay sila. Nakaganyan talaga yan. Ang paa ni baby. Hindi po pwede yung toes niya ang i-point towards the edge of the measuring table. Alright? So, yan. So, yung sinasabi ko naman na follow the contour, yun po yung nakagisnan po natin yan. Okay, we let the baby in a side-lying position ng baby. Then from the heel, follow the contour of the body until you reach the vertex. Okay? All right. So, after that one, we have the head to toe assessment. Okay? We check on the head of the baby. Of course, the moldings. Okay? Di na dapat siya mag-overlap with each other. Mag-overlap yung bones ng skull bones lang ni baby kasi hindi pa man nag-fuse yung mga suture lines niya, no? During delivery lang po. Once the baby is out, it is no longer overlapping with each other. All right? Then we check on the fontanelles. Okay? With our previous discussion, we have discussed on when is the fontanelle closed sa ating posterior fontanelle, and the last one to close would be your anterior fontanelle. All right? Then you have the caput succedaneum. If the mother doesn't know how to push during delivery, so this would happen. This is the accumulation of fluid in the what you call this one? Periosteum ni baby. So this is the, what you call this one? Yan. Ito siya yung caput succedaneum. Ang cephalhematoma naman, yung blood. This usually, blood ang nag-accumulate po dito sa periosteum. This usually happen when a delivery via instrumentation is done. Like for example, vacuum. Siyempre naman, when you say vacuum, parang sinisip-sip yung ulo mo. Okay, there is two ways lang po. Delivery via instrumentation. Dalawang type lang po yan. Forceps delivery and vacuum delivery. Okay? Usually, cephalhematoma happens, no, when the mother delivered with the help of vacuum, through vacuum extraction. So, sinisip-sip, gina-force ang baby's head to propel out, no? Kaya yan, parang may pressure na sumisip-sip, kaya yan, nangyayari ang cephalhematoma. Or better yet, kung merong mga accident na nangyari, so nagkaka-sepal hematoma. Then of course, we check on the suture lines. Alam niyo naman yung mga suture lines, yung coronal suture, di ba? Yung lambdoid suture, mga ganyan, yung in-between ng kanilang skull bones. And of course, we have an anencephaly, okay? The baby that has no skull, no? They only live, hindi gani ang ibang baby nga pag iyak, wala na. Antayin mo na lang, hindi talaga ito sila nagsusurvive ng matagal, guys. Namamatay talaga kaagad si baby nito. This is one what's called congenital abnormality, no? Na minsan nakakasad, no, na mangyari sa both couple. No? They have a baby that has no skull, and the doctor would really say na the baby would not really last. Okay? So, ito po siya yung example niya, guys. Ang brain niya, walang protective covering na skull. Okay? So, the face, we check for the blink reflex ng baby, no? If you stroke the lashes, mag-blink by sa baby. Then, of course, check for strabismus. Okay? Or cross eye ni baby. No? Normal, the black of the eye is really following, no? Pero pag nag-separate na, kagaya nito, yung eyes niya, ito, nag-turn inwards. So, esotropia yan. Exotropia naman, ng isang mata po, palabas. Okay? Then, hypotropia, ang isang mata po, pababa. I know that you have had this already with your HA. When you reach the eye, no? Eye turns upwards, that is your hypertropia. So these are the types of strabismus food, guys. No, any unusuality that comes with the eyes, na mag-cross eye siya, maghiwala yung isang mata, ang isang mata nakatutok ng straight, tapos yung isa nakaliko. Yan. Yan yung mga abnormalities sa mga eye. So, ear should be even or above outer eye canthus. Alright? Even dapat siya. So, ang outer eye canthus mo, even dapat siya or higher. No? Higher, a little higher than your outer eye na eye canthus. Kung lower than that, then you have a problem already. Okay, like Down syndrome, mga ganyan. So, magsa-start pa pala kayo. Okay? Hala. Wait lang, guys. Okay, so we have what we call the chest. So, minsan, yung mga baby, lumalabas sila, merong witch milk. Witch milk is yung sa mga nipples ng mga babies na babae. Parang may gatas lumalabas sa kanilang nipple. So, that is normal. That is caused by maternal hormones, guys. No? Normal lang po yan. Hindi lang po yan always na magpuproduce ng milk. Kaya nga tinatawag siya na witch milk. So, sa abdomen naman, check the umbilical cord, no? And then, of course, this is a form of gastroschisis. The baby is born with the intestines outside. So, the baby has absence of abdominal wall. All right. So, the baby, after 2 weeks siguro, scheduled for surgery to put back all the intestines inside the abdomen. So, naapod may case ing honey, pero okay naman si baby karon, no? Okay. Then, of course, we go on to the genitals. Of course, the baby is monitored for 24 hours and making sure that the baby urinates, no, within 24 hours. Okay? Then, meron din tayo mga pseudomenses. Hala, gidugo si baby. Mga newborn. Naala gidugo, yang kuan. So, those are called pseudomenses. Okay? Maternal hormones also has a play on that. Okay? Ang pseudomenses. So, testes should be descended. If there would be testicles na undescended, yan yung tinatawag na cryptorchidism. Okay? So, the baby will be prone to sterility, no? If ever that would happen. So, preterm male has less rugae in the scrotum. So, itong scrotum ng male kasi, this is the outer pouch of the testicles. All right? So, itong tinatawag na rugae, yung kanyang line sa labas. So, kung preterm yung baby, parang makintab lang yung kanyang scrotal area. Yung scrotum niya, walang line. So, yan yung ibig sabihin nila. Preterm male has less rugae in the scrotum. Alright? Then, of course, this is normal, no? Labia minora is prominent in female newborn baby. Nakalabas siya, kumbaga, kesa doon sa labia majora. Okay, so we also have what you call assessment of the extremities of the baby. So, i-flex mo yan siya. Kung ma-flex ba, siyempre i-flex natin kung okay ba yung flexing ni baby. So, creases on the palm like simian crease, yung parang only one crease lang siya, indicative of Down syndrome, Mongolism, no? Yung parang isa lang yung line niya, no other lines is found doon sa kanyang palm, no? So, ibig sabihin yan, may Down syndrome or Mongolism yung baby natin. No? That is how important your simian crease is. Okay? Buti na lang ako, diretso nga siya guys, no? Diretso siya, no? Diretso siya, pero I have other lines in between. Mongoloid na si ma'am. Okay? Okay, so we also have polydactyl or extra toes or fingers like this one in the picture, no? Na siya pakapin. Sa mga tiniguang pa, swerte na siya, no? Kay sobra-sobra iyang extremities. But in some, if you are that person, para mura kag mag-gloves na lang ko pirmi, kay maulaw ko, di ba? And of course, we also have syndactyl No? Webbing of fingers like this one. No? Pag inopen mo na o sineparate mo naman yan, magkakaroon naman siya ng fingers talaga, guys. So, mahirap talaga ang, there are surgeries for this one. Hindi na tayo magdadagdag ng fingers. It just so happen, nag-fail lang na mag-separate yung kanyang fingers. Okay? Then we also have Amelia, absence of upper extremities. All right? Like this one, guys. No, wala siyang upper extremities. Then tocophilia naman, absence of lower extremities. It can be both or just one. So this one, tocophilia. Absence of both upper and lower extremities, I think, is meromelia. No? Meromelia. Then we also have the club foot or the bow leg. This one. Okay? So those are just abnormalities na makikita natin so far. Then we go now to the skin of the baby. Then we check on the color of the skin. Is the baby cyanotic? Or is the baby very pale? Then you have the Mongolian spots. Kaluoy ni baby gi kulata. Muragi kulata, guys, no? These are Mongolian spots, guys. These are really common in European babies food. Lalo na pag blocks, no? Meron silang mga ganito, Mongolian spots. Then vernix caseosa naman, this is a cheesy secretion like this one. Baby. May babies talaga, guys. Kasi itong vernix caseosa, nag-appear talaga ito dun sa loob pa ng tiyan ng mother. But it so happen na nag-increase din siya in some of the babies, no? Na nakikita naman when the baby is born. So, no need for us to remove this one. It is sticky, it is yucky, but it helps the baby control its temperature. When the baby attained its core temperature, this vernix caseosa will just melt down. No? Makita mo na lang ang ganda-ganda ng skin ng baby, very moisturized. All right? I have a question. Ay. No. Okay. Nothing is permanent here, guys. Okay? Nothing is permanent here. This is only present sa newborn. Some of the newborns lang din. Ang sa atin, no? Ang sa atin, hindi ito siya masabi na mura siya alum. No. The Mongolian spots will just disappear as the baby grows old. Alright? Ito, sabi ko kanina, itong vernix naman, hindi siya forever sticky. Mura siya yucky. Kaya nga tinawag siya cheesy-like secretion that is with the baby. So it was advised, no, not to remove this one because this would help the baby attain its core temperature. It will just melt down, no, mawawala lang yan siya when the baby attains its core temperature. Okay? So yan. And it gives additional moisture also sa side ni baby. And of course, yung mag-warm siya. Okay? Lanugo is our fine downy hair. Dili na yun, di ba? May mga babies na born na, hala, mura jud siya unggoy. Dagan siya balahibo. Dagan siya balahibo, dagan siya hair. No? Fine downy hair yan siya. Usually, hindi naman sana magkakaroon ng fine downy hair yung baby once they are already in their right age, no? So, nawawala lang din ito, guys. So, hindi ibig sabihin, nagmana sa kanyang papa, kay daghan siya, kuan balbon na bata. Dili ko na siya mao. Alright? So, hindi po yan totoo. Okay. So, let's go now to the milia. This is how the milia looks like. Para siya mga whiteheads. Makita ganin ninyo ni sa baby, ayaw, taon tirisa. Because this will just disappear. Mga sebaceous deposits lang man ito siya, guys. Kasi 'di ba si baby born na chubby-chubby siya. So sebaceous lang yan siya ng mga secretions found in the forehead, sa nose, sa cheeks. All right? No other area. Just like when you describe meron na remember ako doon sa exam kasi nagbasa ako, no? Saan ba nakikita yung mask of pregnancy? Siyempre, saan mo ba ikakabit ang mask? Hindi sa face mo lang. Bakit ka mag-a-answer ng merong chest or neck? 'Di ba? Oh, XX na 'yun. Doon lang talaga yan siya sa face, guys. Okay? Yung mask of pregnancy or melasma or cloasma. Alright? Yan. Na-remember ko yan. Wala ko, ay, kadali-dali naman ito. That is if you understood literally kung asa gamiton ang mask. Kaya siya tinawag na mask of pregnancy. Okay? So, yan ha. Ito ang last niya. This is your amelia. Okay? Sebaceous deposits na siya sa newborn lang. So, what are those abnormalities in skin color? So, there is what we call acrocyanosis. So, the body is pink while extremities are blue. Okay, normal siya, guys, first 24 to 48 hours of life. Kasi nagre-recuperate pa yung bata. Kung iyak ng ang baby, so definitely later on, the extremities would be pink. Alright? So, hindi siya nakikitaan na ngayon ng any abnormality. Kaya nga, that is how important our cry is sa baby. Ayaw pahilaka ang baby, dili man na pwede. Dapat kung baby siya, iyak siya. Kasi that is the first cry would be the first oxygenation ng katawan ng baby on its own. Not dependent on the mother na. Siya na. It's her life na. So, first cry also is very important to shut off all the shunts that is found doon sa fetal circulation natin. No, the pressure that is created by the expansion of the lungs sa first cry ni baby would have the pressure to shut off all the shunts. Okay, that is how important the first cry is. Okay, then lumabas si baby ngayon na gray color. So, gray color would indicate really infection. Lalo na pag known na talaga si mama na meron siyang infection. And then, the mother is undergoing treatment. All right? So, the baby now, when coming out, if gray ang color niya, so ibig sabihin, merong infection si baby. So, the doctor would definitely, SOP na yan, na magkakaroon na tayo ng antibiotic therapy. So, the baby will be placed on IVF, kakabitan siya ng IVF, and the medication should pass through the IV tubings. Alright? Jaundice. Yellowish discoloration of the skin and sclera due to inability of the newborn to conjugate bilirubin. Okay. That is why sa mga babies natin, hindi pa kasi sila nag-produce ng vitamin K. That is why we are injecting the baby vitamin K. The only thing na makastimulate ang baby na mag-produce ng vitamin K if a food is taken sa gut area nila. Pag nakakain na sila, that's the time na magde-develop sila ng own nila na vitamin K. But for the first time, because the baby will be placed on NPO for 6 hours, for the baby not to develop any bleeding conditions, kaya in-injectan natin siya ng vitamin K. Kasi nga, hindi pa siya ready na wala pa siyang vitamin K to protect herself from bleeding tendencies. So, yan. Physiological jaundice naman, 2nd and 7th day of life. No, nag-a-appear siya. So, kailangan natin ibilad-bilad sa init, no? Sunlight is the key. Okay? So, every assessment for our skin is, ito na, nilagay ko na po dito ang kanyang mga definition. Yan, no? MS, di po siya medical surgical, but if you're talking about babies, these are the Mongolian spots. So these are congenital birthmarks seen most commonly over the lumbosacral area. They are bluish-green to black in color and oval to irregular in shape. So diligid siya pantay-pantay, mayroon siya patches. No? They are most commonly found in individuals of African or Asian ethnic background. All right? So milia. Unopened sebaceous glands found on nose, chin, cheeks, it would definitely disappear by 2 to 4 weeks. So, isang buwan din. So, pag matempt kayo na tirisin, wag naman po. Masasaktan si baby. Okay? Lanugo naman are fine downy hair on shoulder, back, and upper arm. So, it will just disappear as the baby gets old. Then, vernix caseosa is a white, creamy, naturally occurring biofilm covering the skin of the fetus during the last trimester of pregnancy. So, nag-i-increase siya, no, during the last trimester of pregnancy. Kaya sometimes the baby would come out like, uy, unsa man ni, lagkit-lagkit ni baby. So if maganda sana yung kung maka-experience kayo, makakita kayo talaga kung what is vernix caseosa is, no? Okay. So that is for our baby. So let's go now to puerperium or postpartum period. So this happens from the termination of labor until the involution of the uterus. All right. So we should maintain infection-free environment in the puerperium stage. Okay, so the bed linen should not be soiled when the mother would lay down. So sa kanyang room, kumbaga, kunyari nanganak si mama, di ba? So watchers are staying in the room and they are lying on the bed, no? Hospital bed ng patient natin. So we should advise the watchers not to lie there because ang mother natin has undergone an ordeal inside DR and she is unable to move about kasi hinang-hina pa, exhausted pa si mama. So automatically maghihiga siya doon. Then remember, the mother is experiencing slight bleeding but not really bleeding na bleeding. For as long as the uterus is contracted, normal lang yung flow ng blood. Syempre naman, guys, nung galing panganak, na-detach ang placenta. So, there is really blood. Nasugatan yung endometrium ni mama. Alright? So, watch for bleeding. Promote healing muna, then watch for bleeding. Encourage early ambulation. So, the mother, hindi mo sabihin na, ayaw, higda-higda. Maglakaw-lakaw na tano. Not necessarily. If the mother can already tolerate, so you start with the sitting up. And if the mother, you start gani with the turning to the sides. And after turning to the sides, turn the mother to its side gani. And then before sitting down, then dangle mo na ang legs. Then if the mother can move about the legs, no? So, ilalagay mo yung stool niya for stepping. Then, assist mo siya so standing. Then, upo na naman. Then, stand na naman. Then, before you let the mother ambulate on her own. With assistance, pagani na sila. Okay, imagine for how many hours siya, sige, utong-utong, nag-labor siya sa loob ng DR. So, what are you expecting? Alive and kicking, yun kaayo si mama. No? The mother needs some attention also. Kasi postpartum. Then we provide comfort and rest. If the mother wanted to sleep, let her sleep. Okay, for as long as per assessment, the uterus is contracted. When the mother is wheeled out of delivery room, meron man siyang IVF, meron niya naka-incorporate na oxytocin. Aside from the one injected after the delivery of the baby, no? Meron din niyang pabaon si doc na incorporate sa IVF ni mama na D5LR na oxytocin. This would really help the mother regain its strength at the same time prevent bleeding from occurring. Kasi meron siyang oxytocin. Oxytocin would stimulate the uterus to contract until the mother recuperates. Okay? Of course, we provide emotional support. Then, establish successful lactation. So, dito, pag naka-postpartum na si mama, we would really encourage the mother, no? To have breastfeeding or to do breastfeeding sa baby niya. No? Kasi whether she likes it or not, the breast is prepared already for lactation. Okay? All right. So what would be the physiological changes in the postpartum period? You have these reproductive changes. No, the uterus size is reduced. So immediately after delivery, 1,000 grams ang weight ng uterus natin. Then after end of the first week, it's 500 grams. After 6 weeks, 50 grams na yan. So makikita mo ang pag-recede ng size ng uterus through the physical look of the mother. Then the placental site is sealed off. That would really mean that there would be no more bleeding. Then cervical os are narrowed, no? So close na gid siya. Then painful during contraction. So pag ang mama naka-feel po siya after 6 weeks, naka-feel po siya ng parang painful contraction. So that is about normal. All right? Then the uterus remained contracted. So matigas talaga yung ma-feel mo dyan. Kasi pag wala kang ma-feel na parang ganyan, katigas, ibig sabihin saan na napunta. Then you check on the secretion of the mother if the mother is experiencing bleeding. Yun ang tinatawag natin guys, postpartumly uterine atony. No? Pag hindi nakakontract ang uterus. Then most of the cases of mother's demise is hemorrhages. Okay, after delivery. Okay. Ayan. So 6 to 12 hours postpartum, no? Dapat andito na po yung what you call that one? Ang measurement ng ating uterus andito. Okay, then dahan-dahan po siyang bababa. Okay. Bakit siya 6 to 12 hours postpartum? Kasi contracted po siya. Aakyat yan pag contracted. Immediately after birth, syempre, iniluwal niya po yung bata. Diyan muna siya sa letter A. We wanted to establish a very contracted uterus. Dapat andito siya, ang measurement niya. Alright? Sige. So let's go now to lochia. These are discharges of the uterus. Okay, right after delivery, no, we have 3 types of lochia or secretions. So all secretions that is coming out of the vagina comes from the uterus, guys. Unless na nasugatan yung vagina mo, no, yung walls niya or yung cervix, that would really give out some secretions. But definitely, lahat po ng secretions nanggagaling po talaga yan sa uterus. So, postpartumly, 3 type ng secretions tayo, which is lochia rubra, lochia serosa, and lochia alba. So, lochia rubra now, these are the dark red color, which happens 1 to 3 days postpartum. And then lochia serosa naman, pinkish brown in color, which you can observe for 4 to 10 days postpartum. And then lochia alba naman, guys, is yellowish to white, no? 11 to 21 days siya postpartum. Okay. When you say pattern should not reverse, ibig sabihin yan, guys, galing ka sa lochia rubra and then nag-undergo ka ngayon ng serosa. Next to that should be alba, but naging rubra siya. So, ibig sabihin, there's something wrong. So, you need to consult your obstetrician for that one. Okay? So, there should not be any reverse from the lochia. Okay? Follow din siya, rubra, serosa, and then alba. Okay? Then, increase in activity. No? Mag-increase po yung lochia natin pag mag-activity tayo. So, ibig sabihin yan, stop doing something that is very exhausted, that can cause exhaustion, and please rest because your uterus is really crying. No? Gusto niyang mag-rest. So, when lochia increases during activity, then stop. Then elevate your legs. No? So that ma-relax siya. Then decrease in breastfeeding. Okay. So ito naman, ang decrease in breastfeeding, magdi-decrease po yung lochia niya or ang secretions mo pag nagper-perform si mama ng breastfeeding. Kasi through breastfeeding kasi guys, nasi-stimulate ang uterus to contract. Okay? Yan yung sucking ng baby through the breast that would release oxytocin na makapakontract sa uterus ni mama. Okay? It should not have any offensive odor. Okay? Kung rubra siya, amoy dugo talaga siya, guys. Hindi yung parang amoy imburnal or amoy something na mabaho, nabubulok. That is an indication of what? Infection. Then, it should have no large clots. Na apol-apol, di ba? Kung mag-menstruate kayo, monthly menstruation, malipay ka kung mura siya apol-apol. Pero in postpartum patients, apol-apol is prohibited. That would indicate hemorrhage inside. Alright? Of course, it doesn't mean kung na-cesarean ka, wala kang lockya. Of course, you have lockya. Hindi mo lang pinadaan sa vagina si baby. Hiniwaan ka lang sa tiyan. Okay? So, pag hiniwaan ka sa tiyan, ang lalabas na secretion saan? Alam naman sa tiyan, eh syempre doon sa vagina. So, it is also present to when patient has undergone cesarean delivery. Alright? Okay, the vagina. So, ano ang itsura ni vagina? Postpartum, it should be soft and of course, swollen. Ikaw ba naman daanan dyan na napakalaking bagay, no? Of course, the hymen is permanently torn. Ang hymen nga, torn na yan siya if you are a very sporty type of person. Like you always bike, no? I-gymnast ka, naga-split, ano ang tawag dyan? Ang tawag mo dyan? Basta mga extraneous, you are doing extraneous activities that can tore your hymen. So, it doesn't mean you are no longer virgin. So, ibig sabihin ng virgin, guys, is you have not in any way perform any sex with somebody. Okay? Yan yung virgin. Pero kung sabihin mo na gising na, wala na ko hymen, di na ko virgin, dili na indication ng virginity, guys, ha? Kay kung ikaw di ay gymnastic, wa na kay hymen, di na di kay virgin. There's a big difference between that one. All right? So, perineum, yung mga misconception natin with regards to virginity and hymen, ha? So, nasa medical profession tayo, so we should know how to explain that one. All right? So, perineum. So, ano nangyari ngayon kay perineum? Of course, ginawaan natin siya ng episiotomy. No? A surgical incision of the perineum to facilitate the delivery of the baby. So, syempre, pag may sugat ka, magdaan man talaga yan sa pag-edema. Mamamaga yan siya kasi the fluid will rush to that area, repairing that area together with all the blood components, di ba? Kaya magiging edematous talaga yan siya. Then, of course, siya episiotomy is the surgical repair of the perineum. Atong laceration, this is very hard, no, to repair. So, what is the difference between episiotomy and laceration? So, ang laceration, guys, ganito ang mangyayari sa mas. Okay. Musyag nagisi. Uneven ang cut ng muscle, which is very hard to repair on the part of the doctor. Kung episiotomy, straight lang po ang cut yan. Even po ang cut. So, madali lang po siya i-repair. So, that is the difference between that. And of course, yung ginagawa natin na Ritgen's maneuver, right after episiotomy, we apply pressure, okay, on the perineal area kung saan gi-perform yung episiotomy. Why? Kasi pag hindi mo gi-applyan ng pressure yan, pagdaan ni baby, pwede siyang malacerate. That can cause a lot of bleeding also. Okay? So, yan. That is how important the first maneuver is. Okay? Then, labia minora and majora remains atrophic. Alright? So, luy-luy na siya, actually, guys. Alright? Postpartumly. Okay? Okay, so this is the mnemonics and its meaning sa ating episiotomy assessment. So REEDA. So that is your REDA. So R stands for redness. So we check for pain or localized tenderness. Then E stands for edema. Check for soft tissue damage. Bakit siya nagkaroon ng edema? Baka mamaya meron tayong fluid accumulation. Okay? E naman stands for ecchymosis. So this presents parang hemorrhagic spots larger than petechiae. Alam naman natin yung petechiae, di ba? Parang sa dengue, yung mga tuldok-tuldok na flat red spots, no? Iba yon. Ito siya, uneven po yung kanyang bleeding sa ating perineal area. Okay? D is for discharges. And it should be absent. No? Wala dapat nagsisip out from the episiotomy site, lalo na pag na-repair na siya. So if there would be some secretions that it needs to be repaired again, no? Tanggalin, drain the secretion, then tahiin na naman. Then approximation. What is this? This is the scale reliability when evaluating perineal healing. So yung approximation, yung wound separation ng pag-cut mo niyan. So when you assess for the episiotomy site, dapat nakadikit po siya. Nakadikit. Pero pag meron siyang ganyan, yung parang merong space na kaunti, meron pong particular score yan. And it is done by doctors. Okay, yung approximation. So itong episiotomy assessment, andito sa baba guys, healing takes about 6 weeks. So more than a month po. Aantayin ni mama before siya maging komportable. No? Ang masaklap lang dito guys, pag umihi ang babae, di ba, minsan nababasa pati yung ating perineal area. So mahapdi po siya. Yan yung mga ordeal ng mga babae. So we go now to the abdomen. Of course, it is soft and flabby. Okay? Right after the delivery. Para ka parang natanggalan. Pero when you feel for the uterus, guys, it is contracted. But when you feel for the abdomen mismo niya, it is soft and flabby. Okay? Then striae gravidarum lightens. Kasi yung striae gravidarum naman, di ba yung mga stretch natin because of the growing tummy, ang skin natin nagsistretch. Okay, so after delivery, mangunuot na siya until such time that it would disappear. But in some of the cases, or commonly, most of the cases, hindi siya nawawala, guys. Unless you would have something, no, that would lighten it up. Then linea negra disappears in about 6 weeks also. So, para din siyang episiotomy. Nawawala din yung kanyang mga signs, no? Yung line sa gitna. Okay. You can if you wanted to see if you have naaka, but light color lang siya, light brown lang siya. When you get pregnant, it would increase in its color. Dali lang guys kay merong What do you mean by same as a stretch mark? Yes po. Your striae gravidarum, other name for this one is stretch mark po. Okay. So, yan yung nangyayari sa mga skin natin. Lalo na pag sexy tayo, tapos bigla tayong tumaba, nagkakaroon tayo ng stretch marks dito sa arms, sa legs, di ba? Ganon yung mga nangyayari. So, yun. Striae gravidarum is also called stretch marks. Okay? Then we have the breasts. No? Drop in estrogen and progesterone. Right after delivery, there is a rapid drop. No? That would really indicate that the body would prepare for lactation. Okay? Then colostrum is present when sucked by the baby. Okay? Milk would go down if the baby sucked. Okay? It would stimulate the breast or yung ating tinatawag na mga sinuses wherein the milk is stored. When the baby action niya na pag-suck niya, so the milk would go down, no? So that would be your let down reflex. Okay? Then of course, yung tinatawag nila na warm and tender, masakit po ito on the part of the mother. Engorge ang breast, tapos warm and tender. Sometimes nga, gina-fever yung mga mother natin. Lalo na pag hindi talaga natatanggal or hindi nasa-suck out yung mga milk na napoproduce nila. So, it would really make their breast engorge, warm, and very tender to touch. No? Masakit siya hawakan. Masakit talaga siya. Pinagpapawisan na nga yung mga mother nito. So, all we need to do, if the baby is still unable to suck, the husband can help. Or, kung ayaw ni husband, kaya yaki-yaki siya, so, we can advise the mother to buy breast pump. Buy siya ng breast pump. So, kailangan niyang i-extract yung milk. Okay? Milk is produced by the 3rd and 4th day, but colostrum is there already. Kasi, di ba, pag buntis ang mama, nagpe-prepare na rin ang breast for lactation. So, colostrum is present. Further milk production happens on the 3rd and 4th day postpartum week. So, makikita nyo ang mga nagbe-breastfeed na mom, makita nyo very klaro kaayo ang mga veins nila sa ilang dede. Okay? Okay, systemic changes naman tayo, hormone na. After 1 week, the uterus should return to its pre-pregnant state. Okay, after 1 week pa lang siya. Okay, then urinary system. Voiding may be difficult immediately after birth, just like what I have said a while ago, no? And sometimes there will be urinary retention. Okay? Then if ever di nagyud mo antos ni mama, kahiyo na gid kay siya. So after 12 hours, diuresis na. So ibig sabihin ihi na gid siya taman. So the bladder can store about 300 to 600 ml, no? So ngihi na gid siya. The voiding time should be after 4 to 6 hours postpartum, or else the doctor would order catheterization. Hasa man ta mangihi ta or ikateter ka. Oh, syempre, mamugos. Make it a point yun si mama na makaihi siya, or else, kasi masakit po ang catheterization. Whether we like it or not, no? Once the doctor ordered for catheterization, we should do it, or else the mother would suffer. First, the bladder is located anteriorly, right? So that is above our uterus. Okay? So the bladder should be emptied, or else ma-press na yung uterus, the uterus will not contract, the mother is prone to bleeding. Okay? That is the purpose. Why? Binibigyan ng time ni doc ang mother to mag-ihi siya. Okay? 4 to 6 hours postpartum, the mother should urinate. Right? Of course, circulatory system decrease blood volume. Why? It's because during NSVD, about 300 to 500 ml ang mawawala sa mama. Kung cesarean section naman, 500 to 1,000 ml ang mawawala na blood kay mother. Of course, there should be a definite decreased blood volume. But it will return to normal at 1st to 2nd week. Siyempre, ang katawan natin, magre-replenish yan. Meron kasing pinagdaanan si mama, nag-deliver siya. So the body would react on that. Then the heart would really be having problems in distributing the remaining blood volume in our body. So the what you call this one, the bone marrow will be stimulated to produce more RBC. Okay? So automatic naman para naman din yung mga machine yung katawan natin, guys, no? Then, increase plasma fibrinogen and increase WBC for healing. Okay, alam naman natin, ang WBC natin is our aid in recuperating, particularly if we have wounds. Alright? Teka guys, okay. Then we go now to the gastrointestinal system. Of course, the hungry and thirsty ang mama kasi exhausted siya. She has not eaten for how many hours because of labor. Pag active labor na, stop na. Unya, karon di pa din siya mga anak, 10 hours na lang, wa pa siya kakaon kay she is not allowed to eat. no? And even drink water. Only basain lang natin yung lips ni mama. And that's it, no? Yan. Then, slow passage of stool. Of course, guys, ano man ang ipupo ni mama kung wala siyang kinain? Then, positive bowel sound should be that the GI system should be functioning. No? Or else, the mother is not also allowed to eat anything. Okay, lalo na pag mga cesarean delivery section ng mga mama, syempre they have been na-anesthesia sila. So, ibig sabihin yan, pag na-anesthesia si mama, slowed ang function ng mga organs natin, particularly the GI system. Until such time, nung makautot na si mama, that would really indicate na nag-function na, nagkaroon na ng peristaltic movement yung kanyang intestine. So, the mother would be allowed to drink water, no? Mga ganyan. Then, difficult bowel evacuation. Kasi nga, di ba, during pregnancy, guys, the mother is experiencing constipation. So, kung na-constipate si mama, kasi nga si progesterone, gina-slow down niya lahat ng movement ng smooth muscle. And our intestines has smooth muscles. So, coupled with that, if the mother is not eating high fiber foods, no, ano talaga, magkakaroon talaga siya later on ng difficulty in bowel evacuation. Coupled with that also, na siya episiotomy, mahadlok siya, basig magisi ang iyahang samad, o tinatawag, or yung kanyang episiotomy, no, na repair, no, of the wound, no. There is also fear. Because of fear, nagkakaroon din ng mother ng difficulty in the bowel evacuation. Kagaya ko, naka-experience ako nito, guys, no? Difficulty in bowel evacuation. Then, integumentary system, linya negra and cloasma, barely detectable in 6th week. So, alam niyo naman yung cloasma or melasma. This is the mask of pregnancy. So, actually, ang linya negra, cloasma, and even yung striae gravidarum or stretch marks is barely detectable supposedly in the 6th week. But there are some pregnant moms or postpartum moms, nagre-remain yung cloasma sa kanilang cheeks. So, ang labas niyan, guys, parang talumtum, yung itsura ng cloasma, no? Supposedly, it is brought about by pregnancy lang. But unfortunately, no, ang mama nakaka-experience ng mga ganito. No, nagre-remain. Kagaya lang good din yan, guys, kung if you have a genetic predisposition with hypertension or diabetes, no, when you get pregnant, it will be enhanced due to the hormones ng pregnancy. So, sometimes it is triggered by the hormones of pregnancy, hindi na po siya nawawala. Even if the mother has already delivered, no? So, temperature. Vital signs na tayo. Increase on the first 24 hours. No? First 24 hours because of the ordeal, the exhaustion, and of course, the dehydration kasi the mother is not able to drink water during active labor. Tapos, ang lamig-lamig pero pinapapawisan si mama and ano pa yung mga fluid na nare-release niya. So, magkakaroon talaga siya ng slight dehydration and the body would react to that by increasing temperature. Then after 24 hours naman, kung nag-fever pa rin si mama, we look for another or we assess again the mother for the presence of infection. Okay? Then after 3 to 4 days, kung nag-fever ang mama, after 3 to 4 days, doon pa nag-fever si mama. So knowingly that there is milk production, no? Continuous milk production on the 3rd and the 4th day. So we would relate that into milk production. Okay, di ba? Magkakaroon siya ngayon ng tender breast, no? Engorged siya, na warm and tender to the point na kalinturahaw na gid si mama kung dili siya mag-pump. Okay? Then the pulse decrease due to decrease in the cardiac output. Kasi di ba, decrease mo ng kanyang blood volume. Then blood pressure would slightly decrease also. Kasi if you do not have hypertension during your a non-pregnant state, okay? So definitely during most probably when you get pregnant, it is stimulated by hormones, so you have PIH. But if you do not have any genetic predisposition, that the hypertension would stay in your system, so you would have a decrease in your blood pressure after delivery. Then respiratory rate should be normal na, 16 to 20 as of an adult. Ano? Okay. So we have the retrogressive changes. So you have your exhaustion. Due to exhaustion, guys, minsan ang mother hindi katulog, no? Purga feeling of excitement, sleeplessness, or because of the labor or deal in labor, no? Di ka katulog. Kay kung magla-labor ka, nag-i-increase yung pain, no? Until such time, the mother would be relieved once the mother delivered. Yun yun. Then of course, yung fetal movements natin because of the labor pains, no? Energy expenditures, and of course, di pag pakaunon, no? Nothing per orem pag yun tayo, definitely, no? Exhausted si mama. Then weight loss, diuresis, diaporesis, no? Mag-ihi ka, mag-excrete ka, pawisan ka, no? Definitely, meron kang slight decrease in your weight. Then, return to pre-pregnant state, pre-pregnant weight at 6th week because your uterus also receded in size, no? Diba? As what I have mentioned a while ago, no? First day, diba? 1,000 milligrams good yung weight ng uterus natin. Okay? Now, we will go now to lactation. All right. Ang padidi sa baby. Okay? So, we will talk about the mammary gland. Ay! Okay. Mammary gland. Muna. So, our breast is made up of fat tissue. This yellow one. So, these are your lobes of the mammary gland where milk will be produced. Okay? Then these are your lactiferous ducts. When you say duct, it is a passageway or even a storage for the milk. But this will not be the one that produces the milk. The lobules are, but what is inside the lobules would be the one that makes the milk, which is your acini cells. All right? Yan. So, base nakalimutan sa itsura sa tong breast, agian na po na ako ni. Okay, so this is where the baby would suck. Hindi lang po nipple, kasali po si areola pag suck ni baby. All right? Yan. So, I'm going to discuss also how the milk, the physiology of the milk production and ejection. As you can see, there is already letdown reflex here. Okay? So first, right after the placental delivery, there is a rapid decrease in the estrogen and progesterone, which are the hormones of pregnancy. So the rapid decrease would stimulate now the anterior pituitary gland, no, to secrete the hormone prolactin. So this hormone prolactin would stimulate the acinar cells found in the lobes of the breast to produce milk. Then the milk that is produced would be stored in the collecting tubules. Okay, waiting for the baby to suck. When the baby suck, through the suckling, it would stimulate now the posterior pituitary gland to release the hormone oxytocin. This would contract now your lactiferous ducts, or what we call the collecting tubules, to eject the milk. Okay? To let the milk flow to be sucked by the baby. So, milk ejection now is your letdown reflex. Alright? Nakuha? Ito na yun siya, guys. yung breastfeeding. Yung physiology of milk production and ejection. Kasi usually, ito talaga ang lumalabas sa board exam, guys. Yung letdown reflex. All right. So how would you teach the mother, no, in breastfeeding? Of course, you would say, makaon good, magpakaon ka. So you perform hand washing before and after feeding. So clean the nipple with water, particularly warm water. All right? Why warm? Because warm can remove all the unnecessary color sa imuhang areola and nipple brought about by pregnancy. Yung nakakaligtaan natin linisan when we take a bath. No, kay mahadlok ta, kay gilok manggod na siya nga area, guys. So minsan mauna na dili maatiman or di na natin malinisan. Okay? So expose the nipple to air. Okay? Once you have cleaned it, then expose it to the air. Then feed the baby in short, frequent intervals and lengthen gradually. Okay. I have a change in this part number 4. Okay? So if the baby is fed sa right breast, okay? Then, ang sinasabi, short, frequent intervals. All right. Do not remove the baby from the right breast until such time na siya na mismo yung bibitaw sa nipple and areola. Okay? That is the recent, ngayon ng breastfeeding ha. Dili pwede, ibtun si baby, balhin na po sa pikas. Dili na siya pwede, guys. Let the baby satisfy itself with the breast that the baby is sucking. Makita mo naman yan pag the baby is satisfied already kasi mawawala yung kanyang suction sa breast. Moabre na iyang baong ipiyong na iyang mata. Okay? Then, what do you mean by alternate the breast, ma'am? So, kung nagpadeda ka ng ganitong oras, after 2 hours, di syagit na po si baby, kay gutom na naman, then do it to the other breast. That is alternating the breast. Di po ta pwede magingon na permanente na lang dito sa wala. Kay nga no, makimpang ang imuhang tutoy. Kasi na always nag-produce of milk ang ating breast. Alright? Then proper positioning is very important. So I will show you later the proper positioning. Okay, then adequate maternal nutrition and increase OFI. The baby is getting fluid from the body of the mother. Definitely, you should replace it by drinking water. All right? Drinking water. Better yet, after breastfeeding ng mama, gutom naman yan si mama. Pakainin talaga siya. Sabaw is the best, no? Green leafy vegetables that contains a lot of nutrients, and of course fruits. All right, and protein food, panagsa, pero not totally mga fattening, kasi what the mother eats, yun ang napoproduce niya for the baby. Okay, then advise the mother to wear well-fitted bra. We have what we call maternity bra, yung ino-open na lang dito sa gitna para ma-expose yung areola at saka nipple. So that is advised now by the Department of Health, which is less exposure of the breast, no? Lalo na pag mag-breastfeed ka in public, no? Lahi na ba ang tao, no? Kaya abi nato sa unang panahon, okay lang mag-breastfeed in public, pero karon dili na ba okay, guys? No? Kaya ina-advise na lang natin ni mother. Kasi meron na tayong pabili ngayon to cover up the mother if she wanted to breastfeed. No, 'di ba? Meron na 'yang pabili. Iba ma. Okay, just like what I have mentioned a while ago, no? Even a simple stroke sa chin ni baby, dito sa cheek ni baby, that would really stimulate the baby to O muliko na siya mo didi. Itunong na lang yun nimo ang imong nipple o areola sa iyang baba. Then proper positioning. Okay, the proper attachment for breastfeeding would be the baby grasp not only the nipple but also the areola. Then the lower lip turned outward. So dili pwede nag-ana si baby, no? Nag-meet ang imong lips. Itong dito sa baba, lower lip should be turned out, no? Nakadikit siya doon sa breast ng mother. Kaya nga lower lip turned outward. Okay? The chin of the baby touches the mother's breast. So that is the proper attachment ng baby when breastfeeding. So let's go now about the proper positioning. So the head and lower body part must be aligned. So, dili pwede nakaana si baby. Dili po pwede nakaana. The head is higher than the lower body, no. Or the head is lower than the extremity, dili po siya pwede. Okay? It should be aligned. Pantay po siya. Okay? Baby is facing the mother. So, most probably, it should be tummy to tummy po. Right? Tummy to tummy. Magbangga ang tiyan sa mama o ang tiyan sa baby. So, I will show you now. Okay, the proper positioning. Bakit may X? Okay. Okay, so this is what you call the clutch or football hold. Ipiton sa mama ang baby sa waist up. Then the arm is supporting the head of the baby. Then proper attachment is done. Okay? Then we have the side lying or reclining position. Just make sure to advise the mother not to fall asleep. Kasi pag siya yung type ng mother na grabe makaproduce ng milk, pwede po ma-drown or ma-choke si baby sa pressure ng milk that is coming out, no? Because of the sucking. Okay? So, there is a pillow under. Ang baby, nakahiga talaga siya sa antecubital space ng mama. And then the mother is supporting the breast, no? So that the baby would have proper attachment. So we also have here the cradle hold. This is the normal hold, no? If the mother would not really, what you call this one, yung support the breast, kanyari, hindi naman masyado gaanong kalakihan yung breast niya. So, inahawakan talaga niya both. Sinusuportahan niya yung baby niya for proper attachment. Minsan naman, if you are sitting down, tapos gamitin mo ang cradle hold with the help of a pillow under, then nakarest yung head ni baby suon sa antecubital space ng iyong elbow, no? So, there is proper attachment also. Then, the crossover hold. Yan. Ano ba ito? Okay. So this is the mnemonics of the word breastfeeding. So I do believe siguro meron na kayo nito or wala pa. Okay. As you can see ha, breastfeeding is not only best for baby but also best for mommy. If the baby continuously breastfeed, hindi siya weaned ba? Kumbaga, hindi siya mixed feeding, no? Pag wala si mama, mag-bottle feed si baby, no? Continuous breastfeeding yun si mama. Okay? This would really stimulate the uterus to contract. Mag-recuperate si mama, yung uterus niya would return to its involution stage, no? And of course, ang tawag mo dyan, hindi mo mabubuntis si mama pag continuous ang breastfeeding niya. Alright? Kasi hindi siya mag-undergo pa ng cycle. But if one way or the other nag-undergo na ng cycle si mama or nag-menstruate na si mama, careful na, mag-family planning na. No? Then R stands for reduces the incidence of allergies. Okay? So, hindi nakaka-cause ng allergy unless na lactose intolerant yung baby natin. Na pag may lactose, magre-react talaga siya through, kunyari nag-breastfeed siya. Ipupo lang din niya yung kanyang ininom. Magtaka ka ngayon, ang pupo ni baby, bakit white? So, the baby cannot tolerate lactose. No? So, diyan siya, hindi pwede mag-breastfeed. Okay? E stands for economical, no waste. So, wala ka namang gagastusin. Kung ano lang yung ipuproduce ni mama, yun lang yung kakainin din ni baby. Kaya, advise din natin si mama na to eat something nutritious for the baby to have a nutritious also na food, na through breast milk. Okay? Antibodies to protect the baby against infection. So, meron tayo mga IG or immunoglobulin na meron sa breast milk na nagpo-protect sa baby against infection. The baby would be strong enough to fight off infection. Of course, it is sterile and pure sa S and stool inoffensive. Hindi naman sabihin na walang amoy, pero hindi talaga siya that offensive compared to bottle-fed babies. Okay? Sterile and pure. It is sterile and pure. Temperature is always ideal. So, as you can see, warm na po dati ang breast milk palabas. Wala pong breast milk na malamig. Okay? So, temperature is always ideal. Then, fresh milk never goes off. Hindi po talaga siya napapanis. Kasi nasa loob siya ng katawan ni mama. Okay? The only thing that the mother would do is really to make the area where the baby suck, no? Clean. All right? Then, of course, easy to prepare and to digest. That is very correct. No, eradicates feeding difficulties. Sus, unsa may feeding difficulties nimo, di man ka mo sterilize. No, igo raman trapuhan ang dede ni mama. Develops mother and child bonding. There are some mothers also na magpadidi lang, waiting-tingog. This is the only time wherein you can sing lullabies, you can sing nursery rhymes, you can talk to the baby. No? Kasali din yan sa ating health teaching, guys. No, so mother, ma'am, storyahe po si baby ni mo, ma'am. Kay, upon hearing what the mother says, pag lumaki yung baby, maalala niya yan, guys. Na sabi yan ni mama sa akin, even the humming of your mother when you are still a baby, you can still remember that one. Okay? Then, immediately available. Mo gani na no, naamang gani 2 years old na bata no, diretso kuot sa tutoy sa mama. Kay mo tutoy lagi siya. Ang mama po nag-anak po. Agboy di mo po. No, mga ganyan no. Because it is immediately available. Kuhit lang ka kay mama, dede ka, di ba? Kuhit lang mama, dede. Oh, dede. No, si mama mag-prepare na. Okay? Then, nutritionally optimal. So, what the mother eats, the baby eats it also through breast milk. No mixing required. Alam nga namang imong tuyokon, yugon imong tutoy, dili na. It is already premixed. Okay? Gastroenteritis greatly reduced. So, dito nagkakaroon ngayon ng conflict or, kumbaga, discussion between the nurse and the mother. It goes like this. Okay. So, the mother, ang nurse, sabi, ma'am, ingani mong buhaton, limpyuhan ni mong tutoy, kung asa mo, tutoy si baby. Unya, kani imong buhaton, para dili kalibangaon si baby. No? Makatabang ni, dali ra ni ma-digest ni baby. Rami ka ng mga health teaching sa kanya. So, it goes on. Breastfeed si mama, itapuhan niya, tapuhan daw kunuhay niya iyang tutoy. Karon ang color sa iyahang, in vernacular terms, sa iyang areola at ngal. Okay? Ang color siyang atwal dark brown, including the nipple. Dark brown. Okay. Then the baby now has breastfeeding. Okay, nakita po ni mama ni nurse na ang iyahang tutoy o atngal is dark brown. So, when the mother a few days after breastfeeding the baby, natingala siya, tawag niya, ma'am, dali na sa good ma'am be. Ano ko, unsa man, ikalibangan lagi akong baby ma'am. So, kitanaw sa nurse, unsa ang itsura sa iyang pupo sa baby. So, it seems like it is mucoid, yellowish in color, no? And then, gikalibanga gid si baby, guys. So, asan doon ngayon yung pagkakamali ngayon? Is it sa mother or sa nurse? What do you think? Guys, asa ka dito ang naimali? Miss Calo, what do you think? Nganong gikalibanga si baby despite nag-breastfeed siya? So, i-do away natin ngayon si milk allergy kasi mucoid and yellowish in color man ang pupo ni baby. What do you think? Is there a break in the Miss Calo, are you there? How about Miss Benguil? Miss Benguil? Di mo minaw o di mo magtubag. Miss Malunes?
Hello po, ma'am.
Sino yun nagsalita?
Malunes po.
Okay. So what do you think? Can you chat na lang, sagutin mo nila ako sa chat, please. Miss Malunes. I just wanted to see kung anong idea nyo kung saan doon yung pagkakamali. Is it sa mother or sa nurse? Miss Malunes. Anyone can answer me through chat? All right. I have here an answer na sobrahan po. Okay. Then, meron sa nurse po, ma'am, dapat po may instructions how to breastfeed the baby. The nurse have already given the instructions. Okay. Then, meron ditong sagot. Okay, di ba ma'am, sa pag-breastfeed sa baby, i-position lang ang, wait lang. Okay. I-position lang ang mouth, i-position lang ang mouth sa baby near sa areola para ang baby kusa mismo mag-open sa mouth para masak yung needed amount of milk. Yes, of course, that is correct. So, hindi po nasobrahan si baby kasi the baby only ask for another feeding after 2 hours. Kasi pag newborn ka, every 2 hours po yung feeding natin. So, nagkaroon ngayon ng gastroenteritis. Kasi nakalagay dito sa mnemonics ng breastfeeding natin, guys. It is greatly reduced. Right? Gastroenteritis is greatly reduced. So, hindi nagkulang si ma'am nurse ng kanyang health teaching. Ang ngayon, ang nagkulang ng care is the mother. Because as the nurse checked on the breast of the mother, then the areola and the nipple changes in color. Because yung nag-breastfeed si mama, first time nag-breastfeed, si nurse nag-instruct sa kanya on how to go about it. So nakita niya, nagpunas po si mama ng kanyang dede. But the punas is not enough pala, guys. Alright? Kasi from dark brown, nagiging light brown po ang itsura doon. So, ang nangyari ngayon, the baby had already swallowed all the impurities found in the areola and the nipple. Kasi nag-light brown. Ibig sabihin, it's not the natural color of the one that is seen by the nurse during the mother's first time na nag-breastfeed. So, ang tagip-tip na na-build up ni mama during pregnancy is sucked by the baby. That is why the baby's gut cannot tolerate the cannot tolerate the impurities that is taken in. That is why magka-gastroenteritis yun. So, in this case, the nurse now would really uh, advise the mother na hindi po enough yung dapli lang po ng paglinis ng ating dede when we breastfeed. We need some pressure applied on rotating, no? Kunyari, ang gamit mo, cotton ball ba, soak in warm water, or washcloth ba, soak in warm water, in removing or cleaning your breast before you feed the baby. Ha? So, yun. Ang tagip-tip di ay naswallow ni baby. So, the baby is treated with gastroenteritis. So, madali naman din na ayos si baby, no? It's because continuous pa rin ang breastfeed. Okay? Ang breast milk that is coming or produced by the mother is very nutritious din na, guys. And it also affects the quality of breast milk by the nutrition taken in by the mom. The diet, kumbaga tinatawag na kung ano yung kinakain ni mama. Kung puro junk ang kinakain ni mama, junk din yung napuproduce niya. So yun din ang nakakain ni baby. So advise your significant other that is breastfeeding not to eat junks. No? Nung always ka na lang mag-order sa McDo, Jollibee, those are junk foods. Alright? Okay lang yan order tayo niyan once in a while lang. Hindi talaga always. No? Just to satisfy ourselves. Okay? So, yun. So, kailangan talaga ng rigid, no, na health teaching when it comes to breastfeeding. Kaya nakalagay yun dito sa ating letter G, gastroenteritis greatly reduced. Gisisi pa taon niya si nurse. Naingon ka, ma'am, di kalibangaw na kung bata, nga naman lagi ni ma'am. Okay. So, ana, no? So, careful lang punta. Okay? So, yan. That is a lesson learned also, no? Okay, so now I would really wanted to share to you the storage of breast milk. Okay? Pag nilagay, kasi meron na po tayong pabili ng mga storage bags. For working mothers, no, you can carry this one. Kasi meron naman din tayong pabili ng mga pouches, di ba? Guys, na wherein it is silver lined. Anong tawag mo dyan ng mga ano ng mga bag carrier na may silver sa loob. And then you can put there the breast milk that you extract, no? And put it in a breast milk bag, storage bag. And then when you get home, you can feed your baby for that. And it is naandin siyang instruction there on how many hours. So, ito naman yung storage. Kung sa bahay ka, hindi gutom si baby, fed mo na, tapos masyado pang puno ang feeling mo sa breast mo, then you wanted to pump it. So, nag-pump ka, nilagay mo sa ref. Sa refrigerator lang. It would last for 5 to 7 days. Alright? Kung room temperature lang, 4 to 10 hours. Gilagay mo lang siya on top of your table. Depende na rin yan, guys, ha, kung gaano ka-warm ang inyong surrounding. It can be 4 lang ang tagal niya, or it can last up to 10 hours. Centralized day among balay. No, ibutang na ko diha sa taas sa among dining. So it can last up to 8 to 10 hours. Okay? Kung freezer naman, guys, kana sa inyong ref ba, sudlanan nimo sa freezer sa inyong ref. So it can last up to 12 months. So 1 year po ang tagal niya pag freeze, deep freezer naman. Okay, freezer is 6 months. Deep freezer, 12 months. Okay? Paggikan sa ref, guys, kunyari sa freezer, kuha kag isa ka storage bag sa milk. Gi-defrost nimo, gito kumaga nimo gito. Gibutang lang nimo din ha aron mawala ang bugnaw. Okay? So defrosting ang milk is 8 to 12 hours po. Dapat mainom na ni baby po. All right? Yan. Yun lang ang gusto ko i-share talaga dyan, guys. No? Then, we have also, for those mothers na very desperate, no? Na to breastfeed, pero unsa-unta man nga inverted man ang nipples nila. So, meron tayong 2 ways wherein we can also breastfeed our baby. So, we also have this Hoffman technique. So, this is place your thumbs on either side of the nipple. This is parang kumbaga ginamassage nipple. So if you can imagine this one na ilagay mo yung thumb mo on either side of the nipple, be sure to place them at the base of the nipple, not the outside of the areola. So, di ba? Nipple, then areola, nipple, areola, then breast. Okay? So, sa baba po ng nipple. Okay? Hindi sa labas ng areola. Alright? Sa nipple talaga, base ng nipple. You have to press firmly into your breast tissue. Sa baba ng nipple, i-press mo siya. While pressing it down, gently pull your thumbs away from each other. Okay? So, dalawang thumb, na ganyan mo sa base ng nipple. And then, you move it, ganyan. Parang ginapush mo yung nipple to come out. Okay? From the breast tissue. Okay? Yan. Then, repeat mo. Repeat na repeat until such time na ay mo gimaw ng nipple. Then, you can, the full, para malabas lahat ng nipple, kailangan talaga siya masak. And the husband can also help at this particular moment, no? Para lang jud maka-breastfeed si mama. Okay? The other one would be your breast shields or shells. I cannot find or nang pangutano ko ani sa mga butika but they don't have this one. Only the storage bags ng milk. Okay? So this is done 8 to 10 hours per day. So a nipple shield is a breastfeeding product that's used in special situations. It's a very thin, soft piece of rubber or silicone that covers the areola and the nipple. A small opening at the tip of the nipple area allows the breast milk to flow from your breast through the shield and to your baby. So this is how it is placed there. Kung inverted yung nipple mo, pag ilagay mo yung breast shield, when the baby suck, there is still milk. Ang milk po magpundo dinhi and diri mo suck si baby, guys. So there is still bonding between the two of you even if your nipple is not sucked by the baby, no? Naga-provide talaga ang ano talaga. Kumbaga ba yung nag-develop ng ganito na klase na ano ng mga materials no to be used no para lang yun matawag na nagbe-breastfeed ka even if it is just a temporary nipple no pero at least the baby is attached nahawakan mo si baby habang nagasak siya so the milk is coming from the breast so okay na din ito no okay. So what are the goals of postpartum care? So this is to promote normal uterine involution and return to the non-pregnant state. No? Ito talaga yung goal na magbalik sa involution yung ating uterus. Then of course, we prevent or minimize postpartum complications. Then we promote comfort and healing of the pelvic, perianal, and of course, perineal tissues. Kasi alam natin na nag-create tayo ng surgical incision. So our goal is for the perineal tissues to heal. If in cases of laceration, umabot sa ating puwet or perianal, no? Kaya ang goal naman natin is for the comfort and healing of the mother. Okay? Then assist in restoration of normal body functions by assisting the mother postpartum. Hindi man forever na stay na dyan. For the first hours or first day, no? Na maggalaw na si mama. So, need some assistance. So, we do that. Increase understanding of physiologic and psychological changes, guys. So, meron tayong mga physiologic and psychological changes na nangyayari postpartum. Okay, facilitate newborn care and self-care by the new mother. So we assist, we teach, we assist, and we advise the mother on how to take good care of the baby. Okay, promote the newborn successful integration into the family unit. So we introduce the newborn to the family to be accepted. But minsan po, yung father lang po yung andyan, present. The integration is started already when the mother attended mother's classes. Okay, that is sponsored by the hospital wherein she would deliver. no? Gagaya ng San Pedro Hospital, meron talaga silang mother's class. Kung wala kang certificate from the mother's class, you're not allowed to deliver there. All right? Yan. Okay? Then support parenting skills and parent newborn attachment. So always if the mother would want the baby or would want na siya yung magalaw sa baby, you are there to watch her perform it. And then kailangan din ng a little advice, no, from us on how to take good care of the baby. So provide effective discharge planning, including appropriate referral or home care follow-up. So this is very important, guys, referral or home care follow-up. All right? Kasi minsan pag nakauwi na, nakalimutan na, lalo na pag walang nararamdaman, di na sila babalik sa kanilang OB kasi okay na sila. So to make sure that everything is progressing to recuperation of the body, no? Lalo na sa babae, they need to go back to their obstetrician as it is stated in their discharge slip. Kasi bibigyan sila ng papel for discharge and when to visit the doctor. Okay? Kasi pag hindi talaga natin alam kung nagpa-progress ba ang recuperation ni mama o hindi. Okay? So let's go now to the postpartum assessment. So we have here the AV bubble her or what we call the A stands for the appearance, V for vital signs, V victory for vital signs, B for breasts, U for uterus, B for bladder, another B for bowel, L for lochia, E for episiotomy or episiotomy, H for Hohmann sign, E for emotion, and R rogam. So yan yung meaning ng AV bubble her sa postpartum assessment. So we go now to the emotional phases of puerperium. Okay? So we go now to the taking in phase. So what happens in this phase sa postpartum mother natin? So nangyayari ito siya 1 to 2 days after delivery. So dito, ang makikita mo per assessment sa mother natin is passive and dependent. So lahat ng kailangan niya, nag-uutos siya or naghihingi siya ng tulong. Alright? So, ang nangyayari din dito, she prefers talking about the pregnancy, the labor, and delivery. Kung ano yung mga nangyayari sa kanya sa labor room, doon sa delivery room, mga ganun. Always siyang storytelling. So, uncertain in caring for newborn. So, yung focus niya is to herself, saying what happened during the labor process. So, wala muna siyang interest sa baby niya. So, energies are focused on bodily concerns. So, pagkapanganak mo, sus, naunsa na ni akong tutoy, nadako akong tiyan, mga anak, no? So, there is physical changes, no? Uninterrupted sleep is very important. If the mother would ask that she will not be disturbed while sleeping, so don't allow her to sleep. Okay? Kasi yung ordeal niya sa delivery room, hindi basta-basta po yun. So, kailangan niya mag-recuperate. No, kasi exhausted siya dyan. Then, additional nourishment is necessary. So, kung ano yung mga food na gusto niya, preference niya, pinapakain natin. Lalo na pag wala namang order na hindi pwede niya kainin. For as long as the mother is already okay, the mother is burping, the mother has passed out flatus, then that's the time na pwede na siyang kumain kung anong gusto niya. Okay? So let's go now to the taking hold phase. So the woman begin to initiate action. So in this particular phase, interested na siya in taking care of the newborn. Nag-a-assert na siya ng independence. So you are there watching her perform. Okay? But do not interfere with the performance. Kasi gustong-gusto niya siya yung gumagalaw. No? Kaya nga siya tinawag na taking hold phase. She is in command already. So the mother focuses on regaining control over her bodily functions, particularly the bowel and the bladder, the strength and endurance. So usually this happens 2 to 4 days after delivery. Okay? So the last phase will be the letting go phase. So isip-isip niya may anak na po ako. So hindi na ako single. So she gives up on the old role. Okay? Then ready for her new role being a mother. Okay, then postpartum depression most commonly occur at this particular stage. Okay, hindi siya dito nangyari talaga, guys. Nalagay lang siya dito because yung kanyang first stage, 'di ba? Yung taking in phase, yung mga nangyayari sa kanya doon sa loob ng DR. Dapat merong listening ear to listen sa kanya. Alright? Ang nangyayari dito kasi sa taking in phase, ang lahat ng attention ng mga members of the family, even the husband, is towards the baby. Na-left out po si mama. Nobody listened. Okay. Then here goes the taking hold phase. So, siya na yung gumagawa lahat and everything. Napay time nga, narinig ko talaga ang mother kasi sa lying in kami. Narinig ko pa talaga yung father na nagsabi na, tindog na din ha. Ayaw nag-inarte, nahuman na bito,